About 70 people who suffer from Lyme disease took on a part of the medical establishment today in Arlington. In fact, they've been picketing there for 2 days. At the end of it all, the protesters declared a partial victory. Fox 5's John Henrahan joins us with an update. John.
Tony, there's common agreement in the medical world that Lyme disease exists. In fact, the CDC now estimates there may be as many as 300,000 new Lyme infections a year in the U.S. So the issue in our story today is this. The medical establishment believes Lyme is a short-term disease. Many sufferers say they've had it for years and years, and they need better medicine and better medical care than they're currently getting.
I don't know what you've been told.
Some of the protesters were in wheelchairs. Almost all of them suffer from what they call chronic Lyme infection, which is incredibly debilitating.
And continued to go downhill to where I was stuck in bed for 19 to 20 hours a day, was confined to a wheelchair. At one point, my wife was having to bathe me. Very humiliating for a guy at 26, losing my career and everything.
I'm tired. I can't run most of the time. In school, it's horrible because I will sit through class and just zone out, and then after class I don't even know what just happened.
The protesters had assembled in front of the Arlington headquarters of the Infectious Diseases Society of America, which according to its publications recognizes Lyme disease as being spread by certain species of ticks and recommends only a short-term antibiotic treatment. The society concluded flatly in 2010 that, quote, there is no convincing evidence of the existence of chronic Lyme infection. That guidance limits most physicians and health plans to prescribing only a few weeks of medicine.
It's about 30 days, and if you're lucky, you will have a doctor, an infectious disease doctor, maybe give you 2 months of antibiotics oral, and after that, they will dismiss you.
Many of these patients then seek out alternative physicians, some of which will prescribe long-term drugs, but the entire costs are then borne by the patients. The demonstrators want the guidelines reviewed. The Infectious Diseases Society didn't comment directly, but they referred us to a Johns Hopkins physician, Paul Awerter, who pointed out that 4 studies have concluded that antibiotics did no better than placebo pills in long-term treatments. The demonstrators did get a brief meeting with executives of the society and were told, "We're listening." Although no specific promises were made, the protesters seemed happy with that message. In the past, they said, they have never gotten a response from the Infectious Diseases Society. I got a feeling more to come on this story.
Absolutely. It certainly needs more attention. Baby steps to have that group listening is obviously one step in the right direction.
So a little progress, but just a little at this point. All right, thank you, John.